All right, did you interpret this rhythm correctly? All right, our choices was A-fib, A-flutter, V-flutter, or V-fib. We eliminated V-flutter, ventricular flutter, because there is no such thing. Perhaps they meant to put V-tac. This would be V-tac. But let's look at V-fib. Some of you said let's eliminate V-fib. Ventricular fibrillation is going to look very chaotic. See how it looks like somebody just scribbled with their crayons? Our rhythm was irregular. However, it was not a 300 to 600 beats rate. So that's the first thing you want to ask yourself. Is your rhythm regular or irregular? Ours was irregular, but not quite this fast. So you want to know, is it fast or slow? It said 100 beats per minute. The answer is going to usually typically be higher than that. The third step is you want to know if there is a P wave for every QRS. Definitely we had a lot more P waves than QRSs, but V-fib you would have no P waves. There's no measurable PR interval, and the QRS is not even measurable. So it's a very, very irregular and chaotic rhythm. And that patient would come in with no pulse. They would be pulseless. Sinus rhythm, you would have a rate of 60 to 100. It's going to be very regular, a P wave for every QRS. In order to get your rate, you count each R wave, multiply that by 10. Most strips are going to be a 6-second strip. So this rhythm here, normal sinus rhythm, would have 70 beats per minute because there was 7 R waves. All right, so we got rid of V-flutter and V-fib, so it's either going to be A-fib or A-flutter. Now V-tac, just to know that lethal rhythm can be pulseless or with a pulse. It's usually regular. It just looks like a bunch of QRSs. The QRSs are wide. They're going to be greater than 0.12 seconds. I think on here I wrote 0.20, but it's greater than 0.12. Our QRSs are pretty narrow. This is kind of blown up, so it looks big, but A-fib or A-flutter are going to have narrow QRSs, the normal 0.06 to 0.12, okay? So we know it has to be one of these, and we know our rhythm is irregular, but A-fib, A-flutter definitely can be regular or irregular, but A-fib is usually going to be very, very irregular. So here's A-fib, see our narrow QRSs. Again, our irregular rhythm. There's no definable P wave. It's very scribbly looking, kind of fibrillating for the P waves. And usually the rate is 350 to 600, or you can have a slow to rapid ventricular rate. So ours is set 100, so that could fit either criteria. But we're going to see how to differentiate between the two. How do you differentiate between A-fib and A-flutter? All right, there is no PR interval with A-fib because you can't measure. We had a bunch of P waves, and it was hard to define it. Sometimes it's coarse, sometimes it's fine. It's hard to really tell when one P wave ends and begins, and definitely if you have a bunch of P waves, you can't measure a PR interval. And again, we said that the QRS is 0.06 to 0.12 seconds. If it's very fast, it may even be less than 0.06 seconds. So, which would be considered AFib with RVR. A lot of times when patients first go into AFib, they're in RVR, or rapid ventricular rate. So this one has like 4 P waves and 3 P waves, so we could tell it's irregular. It could either be either or, but there is a way to distinguish between the two. So here's AFib again out of Saunders. Again, your P waves are going to look really scribbly, can't really define them. On our strip, it was very defined. There was like 4 P waves and 3 P waves. So let's look at atrial flutter. Atrial flutter is typically regular, but it can be irregular. The atrial rate is 240 to 400. The ventricular rate can be slow to rapid. But look at your P waves. You're going to have these flutter waves that look like little birds. Look at that. There's going to be more P waves than QRSs. There's no PR interval that you can measure because you got a bunch of P waves. And the rhythm is typically regular, but it can be irregular. But look at our P waves. They're very defined, and they look like birds. So if you see these little birds, these flutter waves, you're more likely in atrial flutter. Atrial flutter. So if you're thinking on the path of an interpretation of atrial flutter, you're absolutely correct. The QRS interval was narrow, 0.06 to 0.12. There's no applicable measurable PR interval because you got a bunch of P waves. Yeah, this condition is atrial flutter. So if that was your interpretation, you're absolutely correct. correct, and you did a very, very great job. So just remember, atrial flutter, you're going to look for the flutter waves, look for those little birds. And here's my critical care textbook where I learned the textbook sign of atrial flutter. Sometimes it's a very fixed degree and it looks regular, but it can be irregular or regular. So if you got it right, great job.